Welcome. Thank you for coming back, especially after yesterday's mistakes. So a couple of mistakes to apologise for in a minute. Sunday the 28th of June. Now the first set of mistakes I made was I copied some data wrong from an American TV site, and that made the daily cases of increasing cases in some states in the United States look higher than they were. So that was a simple clerical error. I apologise for that, and I will be correcting it today. The good thing is lots of you people picked up on it. So I've got lots of peer reviewers all around the world to correct me when I go astray. So thank you for that, and it will be corrected today. Apologies. It was misleading, but having said that, the trends that we did identify yesterday are unfortunately accurate. And the second mistake, before we go on to look at global cases in the US in more detail, was from the UK. Now, I said that the level of decrease in cases in the UK had flattened out, when in actual fact it's still going down. It's going down much more slowly than it was, but it is actually still going down, albeit more slowly. Now, the reason for this misunderstanding, or mistake really, was more complicated. What has actually happened is the COVID-19 symptom tracker app, the Zoe Tim Spector group from King's College London, what they've actually done, it's very clever actually, this survey. What they've actually done is they have started to incorporate the results of antibody testing into their data. And especially in London, there's lately been a lot of antibody testing, so it's now clearer who has had the disease. So they had to start incorporating this onto their data yesterday. And what that means is that last week's data and this week's data aren't quite comparable. And that gave the impression that things had levelled out, when in actual fact they're still going down a bit. But it's good. It's good because it means the data is now more accurate. So they've already taken information from well over 1 million people reporting symptoms. They've taken information from lots and lots of antigen testing, and now they're taking information from antibody testing as well. So it's actually becoming more and more accurate as time goes on, as opposed to the mistake I made in the United States, which was just simple clerical error. Now, going on to, let's do some global cases first. I have included a lot more references today, by the way, seeing I've got so many quality peer reviewers around the world, which I appreciate, and thank you for taking the time to write in. Now, globally, we've got 10 million confirmed cases now, and we've got 500,000 deaths globally. And the official recovered cases are nearly 5 million. So that means if this is accurate, and of course there's limitations to this, this is from the Johns Hopkins site, that means there's still an awful lot of active cases there. 5 million active cases, in fact. So quite how accurate that is, we know it's not accurate. We know the real numbers are higher. But that's the official figures. But what is accurate is 196 countries and territories. So I think that is pretty well everywhere in the world now, apart from Antarctica, is affected by this pandemic. Now, the epicenter at the moment, I think it's fair to say, most cases now are in the Americas. North America, the United States, Canada, much lower rate of increase in Canada. In fact, many provinces in Canada are doing very well at the moment, but South America and Mexico not doing well at all, I'm afraid. Now, I want to illustrate this, and I've put the link in for this. So this is the R value. It's just under R values in the notes. In fact, I'll show you where it is on the notes. So what I'm doing now is all of these get just cut and pasted into the comments. So if you click on that link there, the R value, the RT is the real-time value, the reproductive rate in real time. So what I've got here is this is this site. Now, this is data from, these are all the states, of course, and this is in tells you the state there if you hover over it. It's just amazing what all this lifetime website stuff does these days. So that was 3 months ago. So as we know, there was increases in the States 3 months ago. Then lockdown measures were instigated and things got way, way better. So here we see there's only a few states, Maine in that case, North Dakota, Alabama, Arkansas, and Utah that were above the critical value of 1. And of course, if the RT or the R value is above 1, that means cases are increasing. So things got dramatically better there as a result of the lockdown measures in the United States and the other measures that were taken. But then a month ago, we see that cases started to increase in many states. So that wasn't good. Then 2 weeks ago, it was increasing more. So now we see all of these states have got increasing values up to Nevada there with an estimated RT of 1.5. And this, of course, means that every infected person in Nevada, on average, was infecting 1.5 previously uninfected people, meaning the rate was increasing. And this is the latest now. Now, okay, there's big error bars here, but we can see that these states are definitely increasing. So Nevada 1.52, Florida 1.43, and this is going to lead to very great accelerated, what we call exponential growth. The values are above 1. The state with the least cases, DC. I don't know what DC is. My American geography is appalling, but Massachusetts, they're doing quite well. Connecticut doing quite well. So these are the latest figures. So we see all of these cases increasing. Now, if we go down on this site, and you can spend hours on this, it's just so interesting. It gives you all the states and the RT value for the various states. So we see, for example, at the moment, the latest data we have, a few days old now, but Arizona 1.2. So for every infected person in Arizona, they're infecting another 1.2 other people. And you can go through and find your own state. So clearly Florida high, Georgia high, Hawaii is still quite high. A lot of southern and western states badly affected at the moment with increasing cases. Yeah, Nevada 1.52. So you can spend a lot of time looking at this site. Very, very interesting. It tells you how the RT value there is calculated as well. And the other thing that's of interest here, just while we're on this screen, is the increasing cases. So this is the daily new confirmed COVID-19 cases. And this is on a 7-day rolling average, so it kind of smooths out the day-to-day changes. And what we see is the problems in the Americas writ large, really, in this graph. So these are increasing cases per day. Now, I suspect this is artifactual in Brazil. I do hope the cases have turned back down, but I don't think so. In the United States, we see this is a linear scale. So we've gone from 30,000 to over 35,000 new cases per day. And in India is coming up as well, just by comparison there. So that's the situation in the United States with these increasing cases. So let's just look at that. I've put this in a different form here. So well over 2.5 million cases in the United States. Now, with the number of cases increasing dramatically now, there will be a lag, but then deaths will increase. And these are the official figures for recovered in the United States. So if we take that 1 million off that 2.5 million, we see there's nearly 1.5 million people with active cases in the United States at the moment. As we said, southern and western states particularly affected. And that was the R value site that we've just looked at. Do go on there. You can just click straight through it from the description, and you can look at the graphics we just looked at. Now, Texas. Greg Abbott regrets on bar reopening. Now, I was on what was I on? I was on one of the American channels. Anyway, we'll come to that in a minute. And it showed pictures inside some of these bars. And it was consistent with the data we've looked at lately, where this infection is being driven mostly by young adults. So young adults congregating in bars. And there was some excellent video of two people talking to each other, and you can see the breath and the particulates coming out. So the particular risks in these bars are inside, poor ventilation, people talking face to face. So if you want to talk to someone and you're back to back, then you've got a much lower transmission risk. But talking face to face, often fairly close, the droplets coming out, and virtually you have got guaranteed spread in that situation. Now, the other thing is that with people talking, and often in bars there's a lot, so when you're talking there's a lot more droplets and aerosolization coming out. And as well as that, in bars probably there's music going on, so people have to talk more loudly, and that results in even more aerosolization and more droplet formation. And as well as going directly from me as an infected person into your mucous membranes, that's also going on to things like bar surfaces. It's going on to glasses and other things that act as fomites. So bars are a real big problem. And I actually think we were talking about the demonstrations in the United States over the past few weeks. And the good thing about those was, even although there was crowding, it was outside. So the transmission risk is less. Now, it's bad because there's shouting. It's bad because there was a lot of close physical contact. We know a lot of people in the National Guard, for example, became infected. Not saying it was good, but indoors, it's a much greater risk, much greater risk. So Greg Abbott, governor of Texas, I believe, he regrets opening bars and he's now closed them. So they're now closed as far as I know. Now, the cases in Texas. Now, these numbers of the total cases, I've got all these from World Meter. So these are all World Meter cases. So 2 days ago, another 5,102 cases in Texas. Yesterday, 5,285 new cases in Texas. And of course, the number's increasing. Now, a High Court judge, or I'm not quite sure the way the judicial system works, but a judge in Texas has said that the immigration centres are on fire with COVID-19. Now, this is not medical language. I don't particularly like it. But I think we get the gist of what that justice was talking about when she mentioned on fire. And she's ordered the release of children from immigration centres next week, I believe. So immigration centres, again, largely indoor environments, fairly crowded conditions, spread's pretty well guaranteed. So Texas, greatly increasing cases. California, likewise, again, that's the World Meter total for California. And again, 5,972 cases in the past 24 hours. Now, that number there I got from UK media outlets, the Telegraph and the Guardian. I compared both of them. I'm not quite sure where they got that, but that does seem to be accurate. World Meter was not giving the number of new cases this morning when I checked. Florida. Now, again, this is the number of increasing cases in Florida in the last 24 hours from several news outlets. That's the total cases in Florida from World Meter. So these are pretty close. They're pretty close to being right. Bars have been closed in Florida again as transmission sites. When these are described as bars, I would actually describe them more as nightclubs. They're like throngs of mostly young adults. And we've saw from the data in the United States that it's young adults that are testing positive mostly. Now, it really is a pity. So if young adults have to go out to work, that's one thing. Well, if anyone has to go out to work, that's one thing. We can accept a level of risk from that. But here there's been huge infections being driven from young people socialising. Now, of course, I can understand this. I socialised myself one night when I was young. You can understand why people might want to socialise. But it's a huge infection driver. And, of course, these younger adults who aren't suffering particularly badly themselves are infecting their parents and their grandparents. Now in Florida, Dr. Craig Meek is an emergency physician, and he said that relatives can't understand why loved ones are sitting in an emergency room when they're critically ill, because the hospitals are virtually at capacity. So Dr. Meek there is saying the situations where acutely ill, critically ill people are sitting in waiting rooms waiting for treatment. And the sad fact is some of them might die while they're waiting. Let's hope not, but that is certainly a major risk. Houston, Texas, ITUs are at capacity. Now there's long lines for testing. Now in the UK would say there's long queues. What it means is people are waiting for testing. And of course in Florida it's pretty hot at the moment, so I imagine it's a fairly unpleasant wait, mostly for drive-through testing. So long lines or long queues for testing. Young people driving infections, as we said. Carlos Gimenez, the mayor of Miami, I believe, has taken the decision to close Miami beaches for the 4th of July holiday. He's closed the beaches. So Miami Beach is closed from the 3rd to the 7th of July. And what he said was after Memorial Day, there was again where the beaches were busy, there was a 2-week delay, and then there was a spike of infections. Now I know the beaches are outside, but people do get very close together on these beaches. There's a lot of socialising, as you would expect. But it's not just the outside beaches. You've got to think of things like the toilet facilities. So if you've got a beach with a few tens of thousands of people on it, there's obviously going to be significant toilet requirements there. And toilets are a particular place where infection is spread. And we know that this can be directly from the breath, and we also know that it can be spread from feces as well. So quite a lot of reasons why this is an infection driver. Then of course people tend to go from the beach to the bar, and we know that the risks associated with bars. Anyway, that's it. Beaches in Florida closed for that period of time. Now Arizona, the leadership there seems to be less decisive than in Florida. Fascinating the way all these different people are reacting. So the cases in Arizona are increasing. Again, that's the world meter total. Now, whereas in Florida things are being closed and mandated, the governor in Arizona is just urging people to stay at home. Much less mandating going on. And to be quite honest, from the data I've got so far from the United States, this is unlikely to work. So I really do think that people being urged to stay at home probably will not work, and that will result in a continuation of the increases in Arizona. ITUs are near capacity. This is the NBC, that was the news channel I was looking at. Again, you can check the link there for yourself. South Carolina, cases increasing. Georgia, cases increasing. Nevada, all as we looked at on the R value. Now, Anthony Fauci, the government's current strategy for finding and isolating is not working. This is not good news. So when one of the most senior doctors in the country says the current strategy is not working, that is concerning. Because we need to test, track, trace, isolate every case. And at the moment it's simply not happening. Therefore, carried on accelerated spread of the disease is guaranteed. A big driver, as we looked at yesterday, significant asymptomatic spread. So Dr. Fauci confirmed that yesterday, Saturday, and we know we also looked at CDC data yesterday, which shows that 40% of the spread is driven by asymptomatic people, and we now know that many of this spread has occurred in bars. And Mike Pence has said, what were the words he used? I think it was something like he's exercising an excess of caution. So it's good to know that Mike Pence is exercising an excess of caution, and he's cancelled campaign events in Florida and Arizona for next week. Now that's quite a lot in the United States there. I've got things that I want to tell you about other countries as well. I'm going to do it as 2 separate videos, otherwise I get uploading problems. But what I'm going to do now is John and Jasmine from Singapore have sent in a fascinating video that we can look at now, which my apologies you're not seeing. There we go, let's go back to the start. So this is contact tracing apps in Singapore. Trace Together app. So you download the app. Good hand hygiene. Preferred if you'd press the button there with a tissue. Plenty of public information in the lifts there in Singapore. People going into the shop are scanning in, so there's a record of where they've been. So all these shops have got their own internet codes there on the door, and they know where they've been. So if it does turn out there's been spread from that particular facility, the individuals can then be contacted and self-isolated. Also going into the coffee shop, again, you're not admitted, you're not served unless you have logged on. So I guess if you leave your phone at home, you can't do anything in Singapore. But it's a very safe strategy. Safe entry pass. Social distancing for queues and lines, of course. Looks like some political messages there. Okay. Now, I do appreciate that. That's a very useful thing to for John and Jasmine to send in. So it shows that the app is up and running in Singapore. So there's a record of where people have been. Then if it turns out that a case has come from that area, they can be contacted and they can self-isolate and get tested. Can you see that means we're targeting interventions? Interventions are targeted. And that's not happening in the UK and it's not happening in the US. I know a lot of you aren't going to like the app thing, but that's simply what John and Jasmine report from Singapore. So that's all for now. Cases are accelerating in the US and deaths are going to follow. And it's not looking too hopeful really for the next few weeks and months. What that will mean is health facilities are going to be greatly taxed. It means there's going to be an increase in death rate. And I suppose you could say on the good side it means that herd immunity could be reached quicker, but it's going to be a very expensive process. And a lot of people are going to get quite sick and an awful lot of people are going to die to purchase that herd immunity. Right, more from other countries on the next one.